Good morning, everyone, and welcome to the UC Berkeley family. My name is Jurrisha Johnson, and I'm the leave of absence coordinator for the Benefits and Leaves Unit within People and Culture. I'm here to give you a brief overview of the benefits offered at the UC. Also, my manager, Sharon Johnson, the Benefits Director, my colleagues, Gabe Schmidt, the Campus Healthcare Facilitator, and Janet Suko, the Benefits Program Coordinator, may be online to assist with any questions you may have during this presentation. Please submit your questions via chat. The UC offers 3 benefit packages for employees in a career, academic, limited, partial career, contract, and floater appointments. Your eligibility for a particular package depends on the type of job that you have and the percentage of time that you work and the length of your appointment. The 3 benefit packets are full, mid-level, and core. For the full benefit package, employees are hired at least 50% time or more for at least 1 year or more and are eligible for the primary retirement benefits. You have the option to choose out of the 5 medical plans, the 2 dental plans, and the 1 vision plan. For medical, you will pay a monthly premium. The UC pays the premium for the dental and vision plans, so you won't receive a deduction out of your paycheck for the dental and vision plans. For the mid-level benefit package, employees are generally hired to work at least 100% time for at least 3 months or more, but less than 1 year. And they're hired at 50% time a year and are not eligible for the primary retirement benefits, but they are eligible for the choice of the medical plans. And then those employees who are hired at 43.75% time, you're eligible for the core catastrophic medical plan. This is the only medical plan that would not cost you a monthly premium. So for all 3 levels of the benefit programs, you're also eligible to enroll into the legal insurance, the disability, life, and accident insurance. For voluntary disability and life insurance, you may enroll doing your PIE with no questions asked. If you miss your PIE to enroll in these plans, you will need to complete and submit an evidence of insurability. We have the tax savings programs, such as the tax savings on the insurance premium. It's also known as TIP. We have the health flexible savings, tax savings on the health expenses. We have the dependent care flexible spending account, Bright Horizon, which is a family resource website, and the UC pays for the access and you will pay for the services. You may also enroll the following family members in your UC benefits, and that is your spouse, your domestic partner, your children, and that can be your biological, your adopted, your stepchildren, your domestic partner's children, and then your grandchildren, your step-grandchildren, your domestic partner's grandchildren, or legal ward. The period of initial eligibility, known as PI or PIE, is a 31-day window to enroll into your benefit. It starts on the first day of your eligibility. For example, the day that you begin to work in a position that makes you eligible for insurance coverage, and it ends 31 days later for online transactions. The UC also have a verification process. So they require all faculty and staff and retirees who enroll their family members in their medical, dental, and or vision insurance plans to provide documentations to verify their family members' eligibility. And this coverage is handled by our third-party vendor known as Unified HR. So if you enroll any eligible family members, please do not ignore that mail once received because it's very date sensitive and we will hate for your family members to be de-enrolled from your plans. After processing your hiring paperwork, you should have received your welcome kit from UCPAV. So please review all the documents in your welcome kit. It has a lot of information. Also, UCPAV offers detailed new employee benefits orientation webinar for those who are eligible for the full health and welfare benefits and for the UC primary retirement benefits. The webinar is on the first Friday of the month from 10:30 a.m. to 12 p.m. And for those who are eligible for the mid-level or core health and welfare benefits and not eligible for the UC primary retirement benefits, that webinar is on the second Thursday of the month from 10:30 a.m. to 12 p.m. There is also a pre-recorded session for those eligible for full benefits. offered by the UC Path. To enroll in benefits, you will begin by going on to the UC Net and clicking on the UC Path. And after the 31-day window has passed, there are other times during the year when you can enroll and make changes to your benefit enrollments. And these times are during the yearly open enrollment, which usually occurs in October through November, or other employment changes or life events, such as being newly married or the birth of a baby. Here's a screenshot showing you where you would start your enrollment process. You would click on the link at the top, Employee Benefits, to get the location right to UC Path. And just to add, UCNet has a wealth of information for the university employee. Also, for new hires, UC Path has a personal benefit counselor named Alex, who is available 24/7 on your computer, your phone, or your tablet. Alex is a fun, friendly guy who gets to know you so that you can get the information you need and understand your options personally. Here's additional information about the health and welfare plans here on UCNet. To your right are the links that you would need to log on to manage your benefits. So here are the 5 medical plans that the UC offers. We have the Health Maintenance Organization, referred to as HMO plans, and they are the UC Blue and Gold, administered by HealthNet, and we also have Kaiser. And then we have the Preferred Provider Organization, which is referred to as the PPO plans. And the plans we have is the UC Care, the Anthem Blue Cross Health Savings Plan, and the Core Medical Plan, which is the catastrophic plan. So all of these medical plans are administered by Anthem Blue Cross. An HMO requires that you see a primary care physician, also known as a PCP, to coordinate your care. Referral requirements are needed to see a specialist, and you must live or work in the planned service area to be eligible. You can choose your own primary care physician and select a different primary care physician for your family. If a form is needed for you to enroll, you would need to submit and complete the form through an inquiry from your dashboard in UC Path. Forms can be found in the Forms library on your dashboard in UC Path. If no primary care physician is chosen, HealthNet automatically assigns a primary care physician. If you would like to change your families and your primary care physician, you can, but you would need to contact HealthNet directly. There is no out-of-network benefit except in the case of an emergency or urgent care, no claim forms, and usually no annual deductible. The PPO plan is where you do not need to be assigned a primary care physician. There is an in-network and out-of-network component to these plans. You have the flexibility to see a doctor without a referral, either in-network or out-of-network. The PPO plans offers more flexibility in the physician access than the HMO plans. And as a result, the out-of-pocket costs tend to be higher. But the in-network benefit coverage, deductible coinsurance will be more cost-effective than the out-of-network benefit coverage. And here are the 2 dental plans that the UC offers. There is the Delta Dental PPO, and then we have the Delta Care USA HMO, and the one vision plan known as the Vision Service Plan. And that is also a PPO plan. And just a FYI, the Delta Dental PPO plan allows more flexibility and availability to providers than the Delta Care Dental Plan here in Northern California. And as a reminder, the premiums for the dental and the vision plans are paid by the UC. As mentioned earlier, here are the additional benefits that you may enroll. Please note that you may not enroll in the Health Flexible Spending Account if you are enrolled into the Health Savings Plan, the PPO. MyUCRetirement.com is your choice for all things retirement. Financial education classes are found on this website. I'm not going to go much in details regarding these retirement plans due to the additional information that will be provided by Fidelity, who follows me in this presentation. But briefly, for employees that are eligible for full benefit packages, you are also eligible for the UC retirement plan. There are two choices to choose from. You have the pension choice and the savings choice. So for the pension choice, this is where you will receive a pension with predictable benefit payments throughout your lifetime and retirement, including disability benefits and options for income for eligible survivors. So you want to consider the pension choice if you expect to work for UC for most of your career and you want a predictable retirement income payments. You have the savings choice, which is a standalone 401k style account you withdraw money from during your retirement. The remaining funds can be left to your beneficiaries, but this plan does not include disability or survivor benefits. So you want to consider the savings choice if you want a portable retirement benefit that you can roll over into an IRA or another employer's retirement plan if you leave the UC, and you are comfortable choosing and managing your own investments. If you're eligible, you will receive notification from Fidelity Investments. You will have up to 90 days to elect which plan you would like to be enrolled in. Please do not hesitate on electing. Your election will not be retroactive, but effective on a prospective basis. And then you also have the additional information that can be found on myucnetretirement.com. So the vesting in the UC system does investing in the UC system requires 5 years of retirement service credit for the time worked when you are making contributions. If you take a leave from UC or take part in a workforce reduction plan, you can purchase service credit for your time away. Please refer to the UCRP Service Credit Purchase Guide on the UCNet for more details. If you are a member of both the University of California Retirement Plan, known as the UCRP, and the California Public Employees Retirement System, known as CalPERS, you may become vested sooner or may be able to retire with a higher benefit than if you were a member of just one plan. So you'll need to establish reciprocity between the two plans to take advantage of these benefits. For reciprocity with CalPERS or concurrent retirement with CalSTRS, please refer to the UCRP CalPERS or the UCRP CalSTRS concurrent retirement fact sheet on UCNet. Getting tongue-tied here, sorry about that. The UC offers retirement savings program that you may enroll in. They are the defined contribution plan, both pre-taxed and after tax. And then we have the 403B and the 457 plans. And these plans have annual maximum limits. Here is various resource links to help you navigate your enrollment process and to find answers to many of your questions. And you also have our contact information. And if you have any questions, please don't hesitate to ask. And again, welcome to UC.